As you know, personal protective equipment, or PPE, should always be worn during radiographic imaging. PPE attenuates scattered radiation by 95%, but PPE is effective only if garments are properly cared for and checked regularly for damage. Most states require at least annual safety checks. Here are some tips for care and testing. Handle protective gear with care. The lead or other protective material inside the garment is somewhat rigid and can crack, so don't fold, crimp, or sharply bend the garments. Before using any protective garment, quickly check it for visually obvious signs of damage, such as tears, deformities, sagging lead, or animal bite holes. Store lead aprons on hangers to prevent cracks. Store thyroid shields and gloves out of harm's way. Because the protective material is inside the garment, damage isn't always visible. That's why regular testing is important. In most cases, you should test each PPE garment annually. To test a garment, place it on the X-ray table and take a radiograph using a technique of 70 kVp at 5 Mass. Be sure to wear another set of protective gear while taking the image, or step behind a barrier or out of the room. First, lay the item on the table, then radiograph the entire item. Finally, record the results in your annual quality control log. Whether you reject an item will depend on the location, size, and number of flaws. Keep the number of flaws to a minimum. Here's a radiograph of a protective garment that's in good condition. Note, the 0.25 millimeters of shielding will stop 95% of scattered radiation, but it will not stop the primary beam. That's why the exposure is gray, similar to a radiograph of soft tissue. But when there is a crack or tear, as shown here, the X-ray exposure creates a sharp black area in the radiograph, as if there were nothing between the X-ray tube and the detector. This garment should be replaced. Gloves can also be damaged. Do you think these gloves are okay? Do you see anything to worry about? Look at this small hole in the thumb. Like water, radiation needs just a small crack to get through. Even a tiny crack increases the wearer's radiation risk and defeats the ALARA safety principle to keep radiation exposure as low as reasonably achievable. To summarize, your goal should be to ensure PPE provides an ideal level of protection. To do so, check garments for breaks or cracks in the lead or other protective lining. Visually check garments before wearing. And test garments radiographically at least once a year or according to the manufacturer's recommendations. Replace any garments that allow X-rays through, and always dispose of lead garments properly. To learn more, watch the other radiation safety snippets on the IDEX Learning Center.